As women, our period is one very important aspect of our lives. They can be bothersome when they come with their whole cramps and mood swings that accompany them, and it becomes worse when we realize our periods are becoming irregular. In this video, I'm going to be discussing various things that could make your period irregular and what you should do if this situation arises. Hello everyone, welcome back to my YouTube channel. If you're here for the first time, hi, my name is Busari Moliayo. I am a registered nurse, I'm a registered midwife, I am a Nigerian, and currently I live in Scotland, United Kingdom. On this channel, I film content related to nursing and healthcare, so if you're interested in topics like that, do click on the subscribe button to join the YouTube family and also on the bell icon so you don't miss out whenever I drop another amazing video. With that being said, let's get into the topic. So before I start talking about what exactly can make your period irregular, it's important to understand what a regular menstruation is like. So basically, menstruation is something that starts during puberty when a woman gets into the reproductive age, and it is the monthly shedding of the lining of the uterus if pregnancy does not occur. So it means that if you're pregnant, you're not supposed to be menstruating, and if you're not in the reproductive age, you're not expected to have started menstruating. So those are some of the normal things, and this is expected to happen on average of 28 days interval, although it varies from one individual to another. So it could be between like 25 to like 32 days depending on the person. Now we'll get to that day length when we're talking about the abnormal cycles. Okay, another thing about menstruation that is actually normal is that it may come with some abdominal cramping. Another thing you should understand is that menstrual blood is usually dark red. It may vary from one person to another, but it's usually between like bright to dark red when you're menstruating. And the number of days that you would be menstruating within this 28-day cycle is like 3 to 7 days. Like I said, it varies from one woman to another. Now that we know the normal things, let's talk about when your cycle becomes irregular. Your cycle becomes irregular if any of these things happen. Number one, your normal cycle length becomes longer or shorter. So take for example, if your normal cycle length, the number of days between the first day of your menstrual period and the first day of the next menstrual period is usually 28 days. Once you start having 22 days this month, you're having 25 days next month, you're having 32 days the following month, 28, like the number of days of your cycle begins to go shorter or longer than normal. That is an irregular period for you. It means that if somebody already usually has 24 days for their menstrual cycle every month, like it's usually 24 days that person's cycle is every month. If that continues that way, that may not be timed as abnormal. But if on a normal day you're having 24, then you start going to 30 this month, the next one you're having 32 days, next one you're having 22 days, next one you're having 20, then it becomes irregular for that person. So it's an individual thing. Number two, when the pain becomes unbearable. Like I said in the initial portion of this video, menstruation may come with some amount of abdominal cramps. Don't misquote me. But when the pain becomes unbearable, you're fainting, you're screaming, you're rolling on the floor because of menstrual pain, that is becoming irregular. Now talking about the number of days you menstruate for. If you menstruate for like 3 days and the flow stops, or you menstruate for like 4 days and the flow stops, if you begin to go to like 8 days, 7 days, then it's becoming irregular. If on a normal day, every month when you have your period, you menstruate for like 3 to 4 days, then you suddenly realize that on one month you're going 8 days, the next month you're going 9 days, and on some months just 1 day, that is becoming irregular for you. Same as the color. If the color was usually bright to dark red and now you're getting black color, it is irregular. So what I'm trying to let you understand is that this menstruation as a whole is still individualistic, if there's any word like that. Anyway, the way it applies to one individual is different from how it applies to another person. So you need to study yourself, know what your period is like, know what your cycle is like, know how many days you menstruate for, what the color looks like, and even the amount of blood. Because if usually you use like 3 pads every day and realize that suddenly you're beginning to use 6-7 pads, that is an issue, and that means your period is now becoming irregular. So any shift from your normal period is what you will term abnormal. So if you have two women, one menstruates for 5 days, another one menstruates for 3 days, once the person menstruating for 3 days begins to menstruate for 5, 6, 7 days, that is abnormal. And once the person menstruating for 5 days begins to menstruate for 1 day or 8, 9, 10 days, then it becomes abnormal for that person. So 5 is normal for Lady B, 3 is normal for Lady A, but once the figures switch, it becomes abnormal for both of them. I hope you get my point. So what exactly are the things that could actually cause your menstruation to become irregular? One major underlying cause of irregular menstrual periods are hormonal imbalances, and there are a lot of things that could actually precipitate or initiate that. Number one, stress. Another thing is rapid weight gain or rapid weight loss. You could also have hormonal issues such as polycystic ovarian syndrome, that's PCOS. That has to be diagnosed. Don't just assume you have PCOS because you're having an irregular period. Another thing is thyroid issues. If you have issues with your thyroid gland, either hypothyroidism, hyperthyroidism, any issue with the thyroid hormones, then you might have irregular menstrual periods. Certain diseases like cervical cancer, uterine fibroids may cause irregular menstrual periods. Please note that all these conditions have to be diagnosed after a series of tests before you. So don't just assume that you have any of these diseases because you're experiencing irregular menstrual periods. Now, if the regular menstruation is caused by the first few things I mentioned, like stress, rapid weight gain, or weight loss, this could be easily reversible. It means that if you're stressing yourself too much and you stop stressing yourself, the period may return back to normal. And if you maintain a normal weight, the period cycles may return back to normal. But for the other things that I mentioned, it means that if you notice that for a consecutive period of like 2 to 3 months, your cycle is becoming irregular, you may need to go to the hospital to be able to diagnose if any of the other conditions that I mentioned that could cause an irregular menstruation is actually present. Once these underlying conditions, diseases are treated, your period is most likely to return back to normal, except for diseases that do not have a cure at the moment. Do you get my point? So if the underlying cause, the underlying factor has a cure, they're going to more or less take that out, like treat the underlying factor that is causing the hormonal imbalance or causing the irregular menstrual period, and your period comes back to normal. It's really that simple. It's really that straightforward. So now that you know what to do, ensure that you're studying your cycle, because you will not know when your period becomes irregular if you don't know what your regular period is supposed to be like. Take charge of your body, ladies, and I'll see you in my next video. Bye.